Hi, everybody. This is Kevin Gormley again with Leading Edge Financial Planning here with Andy Christopher. Welcome,
Hello.
Andy.
Hello. Happy to be here.
So, so Andy, we're getting into the fall here. So many people think about it's football season. Some people think about, hey, I got to get my costume.
hmm
Halloween is coming. But today we're going to talk about the very exciting season of what?
Open enrollment. The most
Yeah,
important
that's
part of the
right.
fall is picking your
Yeah,
healthcare for the next year. So that's what we
yeah.
got
So
on the docket for today for our United folks specifically.
Yeah, so 90% of the people, Andy, just go and they see whatever they chose last year, and if they have to make any changes, they usually don't, but
Yeah.
they just click the same things, maybe increase the amount of HSA or other dollars. But for those that are really pondering the decision, that's really what we're looking at here. Maybe for some special circumstances, maybe you just haven't really looked at these plans before. And so we're going to go through these. Andy, we have a couple caveats around choosing healthcare and the fact that we're really not trying to lead people to any specific path here. Do you want to comment on those caveats before we jump in?
Yeah, I think most importantly is don't make any decisions based on what you hear today. That's not why we're here. We're here to just talk about pros and cons and things to think about. But at the end of the day, you've got to look at your situation, your healthcare needs, the network, the doctors that you use, and frankly, maybe your budget as well, and use all of those factors to come up with, what makes the most sense for you and your family as a United pilot as it relates to your healthcare.
Healthcare is very personal, and you might have issues that maybe other pilots and their families don't have. And so that's why we think it's really important just to maybe provoke some thought today, be thought provoking in today's video, but not really lead anyone to do one thing versus another. So, Andy,
Yeah.
why don't you jump off? You've taken a deep dive into the United Healthcare plans. If you want to just get started and talk about what we'll cover today, and then jump right into it.
You got it. So we're going to break this down kind of into three parts, right? So let's talk if we're an active pilot at United, things to consider between like the high deductible health plan with HSA coverage. What does that look like with a PPO or EPO, whatever that means, which we'll talk about, right, for those plans. We'll jump into some talk for our military folks who are maybe reservists, so drilling reservists who have TRICARE or retirees, where that means a reservist retiree at age 60 or an active duty retiree who's just on TRICARE. Talk through some of the nuances there. And then everyone's favorite topic is I'm going to retire. Now what, right? When it comes to healthcare, and it gets super complex because now we're talking about Medicare before age 65. So that's when we talk about age 65, that's the line in the sand, right? What is Medicare going to be? How is Medicare going to be a player for us today? And of course, we already talked about this really important thing, right? Talk to specialists, YBR, right? Call up the United folks who can walk you through pros and cons. And then definitely if we're making Medicare decisions, right? And we'll talk about that. But how'd that sound for today's agenda?
Yeah, it sounds great. And I'll just mention as well, Andy is a reservist with, I think it's the Navy.
That's right.
So he does understand a little bit about some of this stuff in TRICARE, and we appreciate your wealth of information that you'll bring there, Andy.
Yeah, you got it. You got it. Okay, whenever we talk about healthcare plans, probably need to just do a quick refresh on what does this all mean and what are these terms that we're about to just chuck at you here for those who are watching. So let's talk premiums. Kevin, what's premium? What do you think about when you think about your premium?
Yeah, premium's the money you pay to be part of the plan.
Yeah, kind of like no matter what, right? And the nice thing about United is, right, you pay 20%, United's going to pick up the other 80% of that, especially if we're talking about those core, so those represented only plans for you. Of course, it doesn't stop there. It'd be nice if we just paid our premiums, but that's not quite how it goes. You can see if preventative care, that's going to be United's going to pay that thing all the way through. That's nice for you to do your annual physical, your vaccines, your shots, right? And then the deductible, right? When we talk about deductibles, that's pretty much what you have to pay out of pocket before the company starts picking up some of the costs for you. So you're always going to pay your premium every month, then you pay your deductible, and then at that point, and there's some nuance there with copays, Kevin. right? Where you may still have some copays and that may not count. But big picture, right? Big picture. Then you jump in what's called a co-insurance. So, Kevin, co-insurance, how do you think about that one?
Well, the deductible is basically we pay first.
That's right.
The copay is we pay as well. And then the co-insurance is we pay together. So the insurance is going to
Nice.
pay some of it, and you're going to pay some of it every time you have some type of service.
Love it. And then at some point, hopefully not, because that means we've used a lot of medical care. We get to that max out of pocket, which is once you hit this number, at that point, the airline's gonna pick up everything for you.
Yeah. Andy, I'll just mention that, sometimes people say that someone got bankrupt because of medical expenses, and really the maximum out of pocket is so important. We
Yeah,
had a max out of pocket a few years ago when my son had surgery, and
there
I
you
think we
go.
paid $7,000, but that's it. After we had paid that amount, that was it.
Yeah.
So that's why insurance is great, and that's originally why people had health insurance, is just to contain any catastrophic expenses.
Yeah, yeah. So then, when I think about when we look at some of these plans, people's eyes first kind of go here, right? And that is important. That's a day-to-day budget discussion. But we've got to probably take a look at all of these factors here as you think about your situation and you think about what could I maybe end up paying. And you bring up a good point about that max out of pocket. To me, when I hear that your story, I think emergency savings, right? That's the first thing that comes to my mind is, hey, what happens if I go with that high deductible health plan, which has a fairly large deductible and max out of pocket? And I gotta come with the cash to pay that, right? Do I have that liquidity available? So those are some things to think about.
Yep, absolutely. Coordination of benefits. I really don't want to talk about it, Andy.
Yeah,
It's
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 too
if you have
complicated.
multiple coverages. Yeah,
Yeah,
multiple coverages. But anyway, we'll get to that at the end of this talk.
there you go. Yeah, for our TRICARE folks and our Medicare folks, that's where that'll be a player. All right. Thanks for the primer, Kevin. Let's talk for our United active pilots. So the first thing to keep in mind is you've got a lot of options, right? When we look at that menu of all the things you can choose, there's a lot, and they break it down by core versus optional. The best way to think about core is this is essentially your negotiated, guaranteed plans. They're called the locked in plans. If you've looked at that ALPA sheet that the union has put out, which is a fantastic source document. But really, they're going to limit it to 20% of the costs, right? And then a max annual increase at 9.5%. When I,
Wow, nine
yeah,
point five. That sounds bad. I mean, imagine if we had inflation of 9.5,
yeah,
but healthcare has been close to 6% a
there you
year,
go.
inflating in history. So
That's exactly right. When I look at it, and we'll show the numbers here, to me, right, my going in thought would be the core is, probably best. Does that mean it's the best for you? Of course not, right? And that kind of gets into our caveats that we've liberally thrown about here for how this might work. But they're pretty good, right? And we look at some of the cost comparisons. Like, yeah, the one thing we'll show that is important to think about is just what's that network coverage. Again, it goes back to you've got this condition, your kids have this condition, you need a certain specialist. Is that core plan, which may be the most cost effective, does that have that network specialist as opposed to maybe an optional plan where they bounce between the Blue Cross Blue Shield and some of the Aetna opportunities available to you?
yeah, the prescription coverage is really interesting to me. I was in pharmaceuticals for 18 years, Andy, and sometimes patients used to complain when they got a generic, and
Yeah.
at the time I wasn't sure if they just were making it up, but actually there are some classes of medicine where even a small percentage of difference can make a difference for certain people, even
Yeah.
active, and then you have non-active ingredients in a medicine. Sometimes people could be allergic to it. So
Great.
again, if you want brand, Core has a star next to it.
There you go. I love it. Yeah. And thanks for that context. That's super helpful. Okay. We've talked a lot about some of the considerations, right? What are your expected medical costs? Now, of course, we don't know, right? It's kind of the reason why we have health insurance. But certainly you might know you're gonna if you've got again the conditions, right, the family conditions, you're maxing the plan out, then you got to take that into account. But current health, take that into account as well, right? Maybe we're both super healthy. I'm talking to you and your spouse and kids. okay, but like, you might roll the dice a little bit there and go with some of those like high deductible health plans that certainly have high out of pockets, knowing that you're going to get some benefits there. We've talked a lot about the network, and then I'll just foot stomp it again. Emergency savings. Look at that max out of pocket and just think, if the worst thing happened, I need to come up with that cash. Do I have the cash available?
And that's why that pocket maximum, either for an individual or for a family, is always a nice number to know. And the other thing, Andy, is that, if you do have a bad healthcare year, somebody gets on a medicine or something, you can then do research for the next year.
There you
We've
go.
had some clients whose, children have gotten on a biological. It's very expensive. And so you can always choose the following year not to have to pay as much.
There you go. Yeah, there you go. All right, so let's jump through sequentially. We'll start that high deductible health plan. Right off the bat here, HSA, right? We all love an HSA, the ability to sock that money away. We call that triple tax benefits, right? And this is 2025 numbers. If you're just on yourself there, 4,300, 8,550 with family. If you're over 55, you can chuck another $1,000 in there. So HSAs are awesome. Of course, you as a United pilot have your HRA RHA in addition. So you've got plenty, I shouldn't say plenty, you've got a lot of options that are unique to the fact that you're a United pilot. And maybe we'll put the link in here, Kevin. We've got some good videos on just how to fund that HRA or some funding mechanisms associated with that. Cool.
Yeah, since it's our show, I'm just going to make up the statistic that 9.95 out of 10 financial planners love the HSA
That's
and
right.
always recommend it. But the issue again for United pilots, Andy, as you've already said, is most people don't have an HRA or
Mm-hmm.
an RHA, and so it is a little bit different calculus for United pilots.
That's right. While we're here, I just want to talk lay of the land. If it's bold and red, that's the core plan that's only available. These are going to be all in-network numbers, individual, and then family that you're looking at here. So just wanted to make that abundantly clear for our folks who are viewing the videos. So between the two here, right? If you were someone who wanted to go high deductible healthcare, probably a high deductible health plan, probably a lower premium compared to like the PPO and EPO, but you can see much higher deductible, higher max out of pocket. Although frankly, Kevin, when it comes to high deductible health plans, like those are not bad max out of pockets. So if you're looking to get into an HSA, like that's not terrible. And then United's actually going to put some money into the HSA for you, that 750 or 1,500. These numbers are inclusive of any employer contributions, something to keep in mind, maybe a little bit different when we have our brain caged to 401k type rules.
Yeah, we've seen a lot of plans, Andy, and our pilots definitely have best
Yes.
in market plans that we've seen, including this type of plan here.
Yeah. Yep. Right on. You want to talk PPO?
Yeah, sure, absolutely. What's a PPO?
Yeah, I was going to ask you.
Oh, darn it.
PPO, right? It means, hey, you can go in network, out of network. You certainly can see a primary care physician or PCP, right? If you've got that. But let's say you had something going on, your foot hurts and you wanted to go straight to the podiatrist, right? Or the doctor. I'm talking from experience, the treadmill accident for me last year, right? And I didn't have to go to my primary care and say, get me a referral for a podiatrist. I could go on Google and type best podiatrist San Diego and see see what happens. But that's, those are the benefits of PPO. Of course, you pay a little bit more to have that flexibility. But if flexibility is what you want and you want to have the largest network opportunity, then this is somewhere a PPO generically, we're just talking sort of broad brush here, kind of makes sense. But what do you think?
Yeah, I mean, PPO really is preferred provider. What's the O stand for, Andy?
I think we're talking organizations.
Organization. Yeah. So you're in control. You have a lot more
Mm-hmm.
control with this. It's really more of the Cadillac plan. If you want to go out of network, you can as well. And just pay more. So if you want ultimate control, this usually is the place to go.
That's perfect. Yeah. You've got a few options. You have a United PPO 1250. That's the same network as the high deductible health plan. You have a straight United PPO. When you look at your benefits packet, again, another fantastic document, and it shows you the map of America and the different network providers. you'll notice some of these swap between Blue Cross and Aetna. So again, a good plug just to think about if you got a doctor that's Blue Cross Blue Shield, then you want to look and make sure that, hey, that's the network provider. And same thing for the core PPO. Again, if you remember, we looked at the high deductible health plan. Now we're talking a deductible of, for a family, $600 max out of pocket of $4,000. So I think a pretty good health plan when you really think about it. Let's talk everyone's favorite, because nobody knows what it is. EPO, exclusive provider organization. Kevin, what the heck does
Exclusive,
that?
Andy. That sounds good.
That's
Exclusive.
right. Exclusive to one network, right? And not you can
Ah,
go out of network, but you're going to pay 100% of this, 100% of those costs, right? So EPO, exclusive provider organization. If you're familiar, United does offer an HMO. We don't have it here, but if you're familiar with HMO, right, that means you have to stay in network. You've got to go to your provider, your primary care, and then they've got to refer you to someone in network to get that coverage. EPO, slightly similar, meaning you've got to stay in network, but now you can go straight to that specialist, assuming that specialist is in network, unless you want to be a cash payer, which you probably don't.
yes, I would say, Andy, for me, like everyone hated an HMO and they stopped having HMOs. So this is an HMO, but they decided to create three more letters and make it an EPO.
That's right.
But it's very, very similar.
That's right. Yeah. So the foot stomp
Except that,
here is the network, right? Got to make sure the network providers align with your healthcare needs. Lots of options available to you. Really, it's kind of between this United Silver Plus and the core. This is, if you look at the map, super limited, and they classify this as catastrophic coverage. I really can't. There'd be some very unique scenarios where I would recommend anyone jump into something like that. But you can see on this one, this compared to the PPO, a little bit cheaper, right? 3,000 out of pocket. So, if you got a great network, you love the doctors in the network, and this EPO aligns with that, then, you might save yourself a little bit of money, right? By going EPO over, say, PPO, a little bit.
yeah, let's move along.
We're not going to spend a lot of time here. It's because there's so many plans. I just think it's helpful to see it all in one place, and you can compare, right, between everything of what is that max out of pocket between the three different plans. So this is super helpful. Hopefully folks, when they see this, can kind of put it all together and just kind of look at them more holistically, because I can't go through page by page and remember. I need to see everything the way my
Yeah,
the way
Andy,
my
I have one comment here. So like with the high deductible plan, you're putting more into your HSA,
yeah,
whereas the PPO, you're sending more of your money to the insurance company right away.
there
So
you go.
that's really a big difference. But again, you can see the out of pockets are just very, very similar as you said.
Yep, absolutely. Yeah, I think again, certainly don't want to make too many specific recommendations, but that HSA is pretty awesome, that opportunity, and those numbers aren't too far off compared to what we see. Heck, even look at the optional. Yeah, right, some of those numbers make it pretty compelling, maybe to not go that route, but frankly, just the way that as competitive as that high deductible health plan is for United, it seems like a pretty good plan, something to consider. All right, for my TRICARE friends here, should you do TRICARE supplemental? Well, here's one reason that's important, because United, which is pretty unique, offers a TRICARE supplemental plan. Why that might be important to you is if you want to access those HRA funds. Remember, it's every dollar per flight hour it gets put in there, plus a lot of 401k complicated rules, still cash. We've got the video that, again, we'll share, that goes into that. But if accessing those funds to you as an active pilot is important, you have to be a participant in a United healthcare plan. By being a participant in the TRICARE supplemental offered by United, you are considered to be on an active plan, meaning you can have access to the HRA, the health reimbursement account. Remember, if you decline United Healthcare, all that money goes into the RHA, and with some special circumstances, you got to be retired to be able to access those funds. So if that's a situation that applies to you, then I think this makes a tremendous amount of sense. That said,
Yeah, I'd
TRICARE
love to.
is, yeah, go ahead, Kevin.
I just love if anyone that's using it and likes it could
Yeah,
ever comment or let us know. we were kind of scratching our head if it was worth it to do it or not do it. We just don't have any opinion on it. So if anyone does have an opinion on it, we'd love to know why it's good and why it might not be good.
Yeah, absolutely. Of course, you can go out and get supplemental plans. I know I've got plenty of friends, who are fellow, military retirees and whatnot, reservists, who go out and get like a MOAA supplemental plan, kind of high level, right? For folks to think about, even outside of the United supplemental, is if you max out those TRICARE costs, right? Certainly the deductible and the catastrophic cap, then that's a time where you might think about jumping into a supplemental plan. But again, as we all know, as folks who are on TRICARE, they can be pretty fantastic and can generally keep costs pretty low. And I talked about right? Or this is the HRA. So I think those are the things to think about from a TRICARE. Certainly wouldn't jump off TRICARE. I love myself some TRICARE and but some other options there. All right. Even more fun, Kevin. What
Okay.
about our retirees? So the number one thing folks want to think about when they retire is healthcare, of course, right? That's
Yeah, it's
that's
usually about number maybe 18th on the list, but
that's right.
obviously an extremely important part of retirement.
Yes, and probably one of your biggest costs in retirement. And I know we've talked a lot about that as well. But
Yeah,
let's
Andy, I'll tell you over the years, one of the biggest concerns people have, not just pilots, all people, is when they say they're going to retire at age 55 or age 60,
yeah.
how are they going to cover health care? And now at least there are some opportunities to get, health care on the open market. But this really is for pilots that might want to retire early.
Yeah. So, I mean, if I could paint a picture here, you're age 60, you meet with your financial planner, they say, hey, congratulations. Like we ran the Monte Carlo analysis. You can retire today, right? And stop flying for United and enjoy that time with grandkids, what have you, all the things you want to do, which is an awesome option and which is great. The rub here is if we're not age 65, we can't jump on to Medicare, right? So we've got to find a way to get some health coverage. United offers you retiree healthcare before 65. Couple caveats here, right? You got to be at least 50, you need at least 10 years of service. And then the premiums you pay associated with that are going to be dependent upon those years of service. So for example, you flew for over 25 years for United, you're 60 years old, you pay 40% of those premiums. Remember, you're paying 20% of those premiums right now, or all pilots who are on a United plan are paying 20%. If you're fewer than 20 years, it flips on you, right? So now you end up paying 80% of the premium. Important to do your due diligence. As Kevin said, you can go out on the open marketplace and get something. I suspect that this is still going to be your most cost-effective option as you think about how to get some health care, right? But lots of things come into play. Does your spouse continue to work? All right, are they part-time, and does that allow them to get access to their company employer provided health care? So plenty of different things to think about when it comes to healthcare options prior to 65. But this is a nice glove save, I think, a really nice opportunity to have some healthcare available. And these are
Yeah,
identical to those active pilot plans. So if you were on that PPO we talked about, then cool, you can stay on that PPO, which is nice. Keep all the same network, all the healthcare providers. Sorry, Kevin, I
yeah,
cut you off.
yeah. So we're told that human beings can get used to almost anything, but if you're used to your healthcare plan and then you're retiring early, you're all excited. You go to the marketplace, you see a plan that's much less expensive with premiums,
Yeah,
and you decide to go with that. You might be in for a shock once you have to do the co-insurance and all the rest of that stuff. So, as you said before, Andy, this is premiums. The thing that was exciting to me about this plan was that yes, the premiums are higher, and yes, it will be somewhat painful, but we believe the rest of the plan stays intact. And this is, as you
yeah.
said, just a great option to look at if you're considering retiring early.
Yes. And the one thing not on the slide here that's important call out is if you don't want to use a United Healthcare plan, it's important to suspend your coverage and not decline it because that allows you to come back into the plan later on. That's all on that retiree checklist, again, on the ALPA document. Super, super helpful, but just wanted to put that out there as an important consideration.
So
Okay.
Andy, just one final thing around this before age 65. We have had some clients that just due to their particular circumstances are not you know, they're income poor. They're not
Mm-hmm.
actually poor, but they are able to get, you know, healthcare through the open marketplace. So that again is
Yes.
something you could check out. Now, there might be some moral issues if you have $50 million and you're on,
In a
you know,
Roth IRA. Yeah.
yeah. So there might be some moral issues with that, but I think it's at least worth looking at.
And Kevin, what you're specifically talking about are the subsidies associated with the ACA. So you get the advertised premium, and then if your income is low enough, because of course you're retired and you're not taking huge distributions from an IRA that's considered taxable income, then you might actually qualify for some of those subsidies.
Yeah. Thanks for saying it a lot better than I
No,
did.
it's all
Appreciate
good. All right. And now let's talk about, hey, we're 65. Got to jump on Medicare. Okay, so the important thing here is no matter what, you have to sign up for Medicare parts A and B. And of course, we have mandatory pilot retirement age, so we don't even get into the nuance of I'm going to continue on my employer sponsored coverage and I'm going to work past 65. Now, a spouse who continues to work, totally different ballgame. And that's certainly an option. But let's say you're 65, time to retire. You're going to jump on A and B. For any of us who've spent some time thinking about Medicare, we know that's probably not good enough, right? And so we got to get some additional coverage. So United offers this Medicare Advantage PPO, as well as a couple other options of drug only. But this is a drug Part D, if you think about it that way, but a prescription drug plan as well as a Medicare Advantage plan. The number one thing I want to, I think, leave folks with here when we talk about this after 65, you're on Medicare is don't assume this is the best plan for you just because United offers a Medicare Advantage plan. It's not a bad plan. I don't believe it to be a bad plan, but you got to look at the costs, right? You can see they cough up $90 for you. You pay the $248 per month. That's in addition to your Medicare Part B premium. But you've got to pay the cost. But you know that might not be the most cost effective. There might be a different Medicare Advantage. There's a lot out there on if Medicare Advantage is really the most advantageous for folks these days, as opposed to things like Medigap plans, which are otherwise called Medicare supplemental plans. And I ran some numbers here, right? You can get one of those for probably 144 to $200. I'm just throwing broad
it.
numbers out there. But Kevin, what do you
Yeah.
think?
Yeah, I mean, all these words don't mean anything to a 40-year-old, you know, like advantage, gap. I mean, I would rather have an advantage than a gap if you
Yeah.
ask me about those two things. But actually, sometimes the Medicare Advantage plans are not the advantage of the clients we work with. I mean, yes, they're
Yes.
going to be less expensive premiums, but really the important things is number one, this decision is not irrevocable. Most
Yes.
of the time you go into a Medicare Advantage plan, you can't go back. And that was something that Andy made a few phone calls and found out that you actually could go back. So that's important. And when you're ready, you'll figure out what the Medicare Advantage is versus the Medicare gap. But to me, the
Yes.
gap is much more, you're able to do much more with the gap than you are with the advantage. The advantage has its rules and you get some things free, but there's also certain things you can't do when you're in the advantage plan.
That's right. Yeah, it gets very complicated on switching plans and the rules associated with that, and whether you have to go through underwriting. So fun stuff. The last piece we'll leave you with here is the scenario of, say you're 65, your spouse is 60, and you got to figure out not only your health care but your spouse's health care. Of course, they're under age 65 and likely can't qualify for Medicare. What are you going to do, right? Well, the only way to keep them on this before 65 plan or keep them on their United plan is you have to go into, right? You have to be a participant in a United after 65 healthcare plan. So more than likely, that means you've got to jump into this Medicare Advantage PPO to keep a spouse or a dependent on this before 65 healthcare plan. And then, as Kevin said, right, you're not locked into that. It's going to be a game day decision every year, right? What makes the most sense for your family, but just things to think about when it comes to that split age, if you will.
Yeah, and Andy, just to highlight, there's the word may and there's the word must, and this is a must. You must be part of this retiree healthcare
Yes.
Medicare Advantage program if you want your spouse to be part of the United Healthcare, and I forget what we call it, under 65 retiree plan.
That's right. That's right.
Oh,
Yeah, before
yeah.
65. That's exactly right. Whew. United Healthcare in a nutshell.
Yeah, so you want a choice? You got choice. You got a lot of choice.
Yep.
But again, Andy, I think just to summarize here, what we believe is that there are some specific situations where you do want to go down this rat hole and look at all this insurance. I mean, if you have a unique circumstance, at least talk to people about what your unique circumstance is. Talk to a professional. There's healthcare people that are out there. Do research, but United has really created a tremendous amount of choices
Yeah.
for a lot of different clients that we serve and that work for United Airlines, and we think that's a beautiful thing.
Yeah, a lot of options, a lot of options. So, well, hope you enjoyed the video for the folks that stuck around. And of course, Kevin and myself were always available to talk in greater detail, especially as it relates to your specific situation. So please don't hesitate to reach out. That's Kevin@leadingedgeplanning.com. And then I'm Andrew @leadingedgeplanning.com.
Leading Edge Financial Planning, LLC is a registered investment advisor. Advisory services are only offered to clients or prospective clients where Leading Edge Financial Planning and its representatives are properly licensed or exempt from licensure. For additional information, please visit our website at www.leadingedgeplanning.com. The information provided is for educational and informational purposes only and does not constitute investment advice, and it should not be relied on as such. It should not be considered a solicitation to buy or an offer to sell a security. It does not take into account any investor's particular investment objectives, strategies, tax status, or investment horizon. You should consult your attorney or tax advisor. The views expressed in this commentary are subject to change based on market and other conditions. These documents may contain certain statements that may be deemed forward-looking statements. Please note that any such statements are not guarantees of any future performance, and actual results or developments may differ materially from those projected. Any projections, market outlooks, or estimates are based upon certain assumptions and should not be construed as indicative of actual events that will occur. All information has been obtained from sources believed to be reliable, but its accuracy is not guaranteed. There is no representation or warranty as to the current accuracy, reliability, or completeness of, nor liability for decisions based on such information, and it should not be relied on as such.